social distancing, always with that face covering on, and just for the amount of time you need, and then get back indoors, and we're going to fight together to get through this. Now remember, when you do that, when you practice those smart rules and you bring it to life and you fight back this disease, of course you're protecting your own family, your own friends, the people in your life, but you're also protecting those heroes we talk about so often. I know you care about our frontline heroes. I know you honor our healthcare workers. Remember, every time you practice social distancing, every time you actually stay home, even when you wish you didn't have to, you're actually protecting those heroes too. On Friday night, I went over to Elmhurst Hospital in Queens, which has been the epicenter of the epicenter. And I was there for the 7 o'clock clap, and it was a beautiful thing when you see all the first responders come out, the neighborhood come out to salute our healthcare workers. This is one of those amazing things that has come up naturally in this city and is a statement of who we are. I got to tell you, our healthcare workers appreciate it. They feel it. They feel your love, and it means so much to them. We got to keep showing them that love. But the way to do that is to help them. Help them by practicing those smart rules to protect everyone. And the other thing we have to do to help them, which is what I'm focused on, the entire city government is focused on, is continuing to get them the reinforcements they need. They have worked through such a tough battle. A lot of them, understandably, are really tired, but they never stopped working. They never stopped saving lives. So we are now getting them much greater numbers of reinforcements to give them a break, to give them a rest, bring in new folks to help shoulder the burden. So as of today, we've added over 1,400 volunteer healthcare workers to serve New Yorkers. And these are folks who are healthcare professionals who are coming here. They're volunteering to go to the front. They're volunteering to go where the situation's toughest. They're volunteering to go into those emergency rooms and ICUs. I want to be clear, we are not asking them to go without pay. We do compensate them. But these are folks who had no obligation to go into places like Elmhurst Hospital or other hospitals that are bearing the brunt. They're choosing to do it because they want to save lives and protect people. Some of them are from right here in New York City. Some of them are people from all over the country, packed up their cars and drove here, took long flights, had to say goodbye to their families for a period of time to be able to save lives here. They're very noble people. And we are so appreciative to all of them, 1,400 who have answered the call. They will be assigned to over 40 hospitals and over 40 nursing homes in this city where the need is greatest. And they are another kind of hero coming to our relief. So if you meet any of these folks, and I've had the honor of meeting some of them, just really let them know how much we appreciate their sacrifice as well and the way they're helping our homegrown healthcare heroes to get through this crisis. Now, these reinforcements will help us a lot, but we still know there's a lot of places that are bearing the brunt, a lot of neighborhoods that are hardest hit, a lot of hospitals that are hardest hit. And one of the things we're seeing in this crisis is that our independent hospitals are amongst those bearing the biggest brunt here. They are smaller hospitals, community hospitals, hospitals that for a long time have not been able to do all the things they wanted to do because they haven't been given the financial resources they needed. And these hospitals, like our public hospitals, our city hospitals, are in many of the places that have had it toughest. So unlike some of the big hospital systems that have, somewhat more resources, these hospitals have really had it tough, and we are stepping up to help them further. We're sending at least 600 additional medical personnel to 11 of the independent hospitals that need it most. And we're taking volunteers from our city medical reserve corps, and we will continue to recruit more and more to make sure that these independent hospitals get the relief they need. This is going to be ongoing. We know, again, this crisis isn't over till it's over, but we know these hospitals have served their communities with so much devotion for a long time, even if they didn't have the resources. We've got to be there for them, and we will.